Welcome back, everyone, to the Deep Dive. You know, we love to go deep on really interesting topics, and today we're diving into photobiomodulation therapy, or PBMT. Specifically, we're going to be focusing on the potential benefits of using 635 and 810 nanometer light panels for pain management. I mean, everyone is concerned these days about the overuse of opioids, and people are really looking for alternatives. So to help us unpack all of this, we have an expert in the house.
It's great to be here. Thanks for having me. Yeah, PBMT is definitely a growing field, and there is a lot of exciting research coming out, particularly the research you sent over that we'll be discussing today really digs into the science behind it.
So before we get too far, can we start with the basics? Just for our listener who might be hearing about this for the first time, what is PBMT and how is it used for pain?
Yeah. Absolutely. So in the most basic terms, PBMT uses low-intensity light to stimulate healing and reduce pain. And the really interesting thing is that it works at the cellular level, influencing how our bodies respond to pain signals.
Okay, so you mentioned these specific wavelengths, 635 and 810 nanometers. What's so special about those? Can any light do this?
That's a great question, and it gets to the core of why I find the research you sent over so interesting. These wavelengths fall within the near-infrared range, which allows them to penetrate deeper into the body's tissues. And that's really critical for targeting those areas where pain often originates.
Just kind of like choosing the right tool for the job. Like you wouldn't use a hammer to screw in a light bulb, right?
Exactly. And the research really drives that point home. One study focused on how PBMT using 810 nanometer light impacted pain sensitivity in mice. They applied the light near what's called the dorsal root ganglion, or DRG. It's a cluster of nerve cells that plays a really key role in transmitting pain signals from the body to the brain.
Oh, interesting. So they are targeting a very specific area in the nervous system. What did they find?
The results were pretty impressive. The mice that received the PBMT showed a significant increase in their pain threshold. And this was across a variety of stimuli like pressure, cold heat, and even inflammation. They were able to tolerate more before actually feeling pain.
Okay, so this is like a measurable change in their perception of pain. But hold on, mice aren't humans. So does this actually translate to us?
Well, more research is always being done, of course, but there is growing evidence that suggests these benefits do extend to humans. And what's particularly exciting is that, unlike opioids, there's no indication that people develop a tolerance to the pain-relieving effects of PBMT.
Wow, that is a huge difference. No worrying about needing stronger and stronger doses over time. But I'm still curious about how this actually works on a deeper level. What is happening in the cells when you shine this light on them?
Well, the research actually delves into some fascinating details about how PBMT impacts specific neurological markers that are involved in pain signaling.
Ooh, okay, get ready, listener, because I think this is where it gets really interesting. Let's talk about those markers.
Okay, so one of the key markers is tubulin. It's a protein that forms these things called microtubules, which are essential for nerve function. And what the study found was that PBMT caused a temporary aggregation of tubulin in the DRG. This disruption to microtubule function could actually be impacting how those pain signals are being transmitted.
Oh, so it's like creating a roadblock for those pain signals, preventing them from reaching the brain as effectively.
Yeah, that's a great way to think about it. The study also looked at something called MGLR1. It's a receptor that's involved in amplifying pain signals. And they found that PBMT actually decreased the expression of this receptor, suggesting that it could be reducing how sensitive those neurons become to those pain signals.
So not only are we blocking them, but we're kind of turning down the volume on how the nerves react to them in the first place. It's a two-pronged approach.
Exactly. And there's one more fascinating finding from the study I want to mention. They saw an increase in something called prostatic acid phosphatase, or PAP, after PBMT. Now, this enzyme actually boosts the production of adenosine, which is a natural pain inhibitor.
Okay, so this is where it gets really, really interesting to me. It's not just stopping or reducing the pain signals, but it's actually boosting the body's natural pain-fighting abilities.
Yeah.
What are the implications of that, especially compared to more traditional pain management approaches?
It is a huge point of difference. A lot of pain medications just try to mask the pain, but PBMT seems to be working with the body's own systems to kind of address the issue at its root.
I see what you mean. I imagine this has some really significant implications for people who are dealing with chronic pain, especially those who are maybe looking for alternatives to medication. But before we go down that road, you mentioned earlier that these specific wavelengths can penetrate deep into tissues. So does that mean PBMT could be used for pain in different parts of the body?
Yeah, that is one of the most promising aspects of PBMT.
Wow.
Because those wavelengths can reach deeper, it opens up the possibility of treating a wide range of pain conditions, not just those that are close to the surface.
That makes a lot of sense. We've been focusing on these very specific wavelengths, but I know there are other types of light therapy out there. How does this fit into the bigger picture?
You're probably thinking of terms like high-intensity laser therapy, or HILT, and low-level laser therapy, or LLLT. They both fall under the broader umbrella of photobiomodulation, but they differ in their power output.
Okay, can you break that down for us? What's the difference and how do you know which one to use?
The key difference really comes down to intensity. So HILT uses much higher power levels. It delivers a more concentrated dose of light energy to deeper tissues. It's often used for more chronic pain or deeper musculoskeletal issues, whereas LLLT uses lower power levels. It's more suitable for treating conditions that are closer to the surface, like wound healing or skin inflammation.
So it's about matching the intensity to the need. You wouldn't use a floodlight to read a book at night, right? You'd use a more focused lamp.
Exactly. And just like choosing the right wavelength, a qualified practitioner can assess your needs and recommend the most appropriate type of light therapy.
That makes a lot of sense. I feel like this is all starting to come together. But I think it's time to shift gears a little bit and talk about what this means for our listener. We've covered a lot of science, but how does PBMT actually translate into benefits for people who are dealing with pain and for the practitioners who are treating them?
That's a really important question, and I think it's crucial to address both sides of that coin. So let's start with the practitioners. PBMT, especially with these specific wavelengths we've been talking about, offers a safe and non-invasive option that can be easily integrated into existing practices.
You've mentioned the safety aspect a couple of times now. Can you elaborate on that a bit? Why is that so important, especially in the context of pain management?
Sure. One of the biggest concerns with traditional pain management, especially when it comes to opioids, is the potential for side effects and the risk of dependence. PBMT offers a compelling alternative because it's non-invasive and has virtually no reported side effects.
That's a huge selling point for both practitioners and patients.
Yeah.
No one wants to deal with unwanted side effects or the worry of becoming dependent on medication. But I'm also thinking about the practical side for practitioners. Is this something that requires a ton of specialized training or expensive equipment?
Not at all. The technology is very user-friendly and relatively easy to implement. Plus, the treatment sessions are generally quite quick and painless for patients, which can be a big plus in terms of patient satisfaction and compliance.
Yeah, I can imagine that also frees up time for practitioners to see more patients. It sounds like a win-win situation. But what about from the patient's perspective? What are the real-world benefits that they might experience from PBMT?
For patients, the potential benefits are truly life-changing. We're talking about reducing pain, improving mobility, and enhancing their overall quality of life.
It's about reclaiming their lives from pain, isn't it? Instead of being limited by it, they can get back to doing the things they love.
Absolutely. And because PBMT is non-invasive, there's typically no downtime after treatment. Patients can just go about their day without disruption, which is a major advantage over other pain management options that might require rest or recovery time.
It sounds like PBMT offers a very unique combination of effectiveness and convenience, something that a lot of people dealing with pain are looking for. But let's be realistic for a second. If the benefits are so clear, why hasn't PBMT become more mainstream? Why aren't we all using light panels to manage our aches and pains?
That's a fair question. While PBMT has been around for a while, it's still relatively new compared to traditional approaches like medication or surgery, and it just takes time for new therapies to gain widespread acceptance, especially in the medical community.
So it's a matter of awareness and education.
Exactly. As more research emerges and as more patients share their positive experiences, I believe PBMT will become increasingly recognized as a valuable tool for pain management.
Well, I'm certainly feeling more informed after our deep dive today. But before we wrap things up, I want to make sure we circle back and really drive home the key takeaways for our listener.
I agree. Let's recap what makes PBMT, especially using 635 and 810 nanometer wavelengths, such a promising approach to pain management. Okay, so we've talked about how PBMT can impact these neurological markers, and one of the key takeaways is that it's not just masking the pain, it's actually helping to reduce inflammation, disrupt those pain signals, and even boost your body's natural pain-fighting mechanisms.
Yeah, it's kind of like giving your body the tools it needs to heal itself rather than just covering up the symptoms, right?
Right, and for both practitioners and patients, the safety profile of PBMT is a major advantage.
Absolutely no one wants to deal with unwanted side effects or the worry of becoming dependent on medication.
Exactly. The lack of reported side effects and the fact that there's no evidence of tolerance development make PBMT a really compelling alternative to traditional pain management approaches.
Especially those that rely on medication. I'm also thinking about the accessibility of this. It seems like PBMT could be a real game changer for practitioners who are looking to offer their patients something different, something that maybe aligns with a more holistic approach to healing.
I agree. PBMT is relatively easy to integrate into existing practices. The technology is user-friendly, and the treatment sessions are quick and comfortable for patients.
Yeah, plus it addresses a growing need in healthcare, the demand for non-opioid pain management options. I imagine that can be a significant draw for patients who are, looking for a different path to pain relief.
You're hitting on a crucial point there. As awareness of PBMT grows, and as more people seek out drug-free pain management practitioners who offer this therapy, we'll be well-positioned to meet that demand.
It's about empowering both practitioners and patients with more choices, right? Choices that are safe, effective, and tailored to their needs.
Precisely. And as research continues, I have no doubt that we'll discover even more applications for PBMT and unlock its full potential for really transforming how we approach pain management.
Well, after this deep dive, I'm feeling incredibly optimistic about the future of pain relief. It's really exciting to think about a world where light could play such a pivotal role in helping people reclaim their lives from pain.
I share your optimism. It's a fascinating field with immense potential to make a real difference in people's lives.
So for our listeners out there, we hope this deep dive has sparked your curiosity about PBMT. It's clearly a powerful tool, and if you're dealing with pain, it's certainly worth exploring further. So here's a final thought to leave you with. Imagine a future where pain management is less about masking the problem and more about empowering the body to heal itself. Could PBMT, with its targeted wavelengths and unique mechanisms, be the key to unlocking that future? We certainly think it's a possibility worth considering. Until next time, keep learning, keep questioning, and keep diving deep into the world of knowledge.
So for everyone listening out there, if you're thinking about what are the big takeaways about PBMT using 635 and 810 nanometers, I'd say first and foremost, the research shows it can be really effective in reducing pain. We saw how it impacted those pain thresholds in those mouse studies, and the implications for humans are pretty significant.
Yeah, and I think what really stood out to me is how it's not just masking the pain, it's like actually working with your body.
Exactly. It's about impacting those neurological markers that we talked about. PBMT can help reduce inflammation, disrupt those pain signals, and boost your body's own pain-fighting mechanisms.
Yeah, it's giving your body the tools it needs to heal itself instead of just, putting a Band-Aid on it. And for practitioners and patients alike, I think the safety profile is really a game changer.
Absolutely. The fact that there are no reported side effects and no evidence of tolerance developing makes PBMT a really compelling alternative.
Especially compared to those traditional methods that rely on medications. And, I keep thinking about just how accessible this could be. It seems like PBMT could be a real game changer for practitioners who want to offer their patients something different, something that maybe aligns with a more holistic approach to healing.
I completely agree. It's relatively easy to integrate PBMT into an existing practice. The technology is very user-friendly, and the treatment sessions are quick and painless for patients.
Yeah, and it addresses a really growing need in healthcare, this demand for non-opioid pain management options. I imagine that could be a big draw for people who are looking for a different way to manage their pain.
Yeah, you're right. As more and more people learn about PBMT and as more people start looking for drug-free options, the practitioners who offer this type of therapy are really going to be in a good position to meet that need.
It's about giving people more choices,
Yeah.
right? Safe, effective choices that are tailored to their individual needs.
Exactly. And as research continues, we're bound to discover even more applications for PBMT and unlock its full potential. It could really transform how we approach pain management in the future.
Well, after this deep dive, I'm feeling very optimistic about the future of pain relief. It's exciting to think about a world where light can play such a crucial role in helping people reclaim their lives from pain.
I share your optimism. It's a fascinating field with so much potential to make a real difference.
Well, we hope this deep dive has sparked your curiosity about PBMT. If you're dealing with pain, it's worth looking into. Here's something to think about. What if pain management was less about masking the problem and more about giving your body what it needs to heal? Could PBMT be the key to that future? It's a possibility worth exploring. Until next time, keep learning, keep questioning, and keep diving deep into the world of knowledge.